12 reasons why healthcare costs are higher in the United States compared to other countries. The United States spends more on healthcare per capita than any other nation, a trend driven by a combination of systemic inefficiencies, market dynamics, and policy decisions. Unlike many countries with universal healthcare systems, the U.S. relies heavily on private insurance, which contributes to administrative complexities and higher costs. Factors such as expensive medical technologies, high prescription drug prices, and the absence of standardized pricing for medical procedures further exacerbate the issue. Additionally, lifestyle-related health challenges and the prevalence of chronic conditions increase demand for services. Understanding these key drivers reveals why Americans face such steep healthcare expenses. 1. Administrative costs. The U.S. healthcare system involves a complex network of private insurers, government programs, and providers, leading to significant administrative expenses. Tasks like billing, insurance verification, and compliance with varying regulations require extensive staffing and resources. In comparison, countries with single-payer systems streamline these processes, reducing overhead. The fragmented system in the U.S. creates inefficiencies that drive up costs for providers and, ultimately, patients. Administrative costs account for a significant portion of overall health expenditures, making it one of the leading factors behind the country's high healthcare spending. 2. High prescription drug prices. Americans pay some of the highest prices for prescription drugs globally. Unlike many other nations, the U.S. does not regulate drug prices or negotiate costs on behalf of its population. Pharmaceutical companies have significant pricing power, often charging far more than production costs. Additionally, the patent system allows companies to maintain monopolies on drugs for extended periods, limiting access to cheaper generics. The lack of price controls and transparency contributes to soaring costs for both patients and insurers, making medication a substantial expense in the U.S. healthcare system. 3. Expensive medical technologies. The widespread use of advanced medical technologies and diagnostic tools in the U.S. contributes to higher healthcare costs. While these innovations improve outcomes, they often come with hefty price tags. Procedures involving MRI scans, robotic surgeries, and cutting-edge treatments are more common in the U.S. compared to other countries. Additionally, providers may overuse these technologies due to fee-for-service payment models that incentivize more procedures. The high costs of acquiring, maintaining, and operating such equipment further inflate overall healthcare expenses. 4. Higher physician salaries. Doctors in the U.S. earn significantly more than their counterparts in other countries, contributing to higher healthcare costs. While these salaries reflect extensive training, high malpractice insurance premiums, and educational debt, they add to the overall expense of care. Additionally, the fee-for-service model incentivizes physicians to perform more procedures, further driving up costs. Other nations often regulate physician salaries and subsidize medical education, helping to control expenses without compromising quality of care. 5. Lack of universal healthcare. Unlike countries with universal healthcare systems, the U.S. relies on a fragmented mix of private and public insurance programs. This system leaves millions uninsured or underinsured, leading to higher costs when individuals delay care until conditions worsen. Emergency room visits become more frequent for those without coverage, as these facilities cannot turn patients away. The absence of universal healthcare also prevents the system from leveraging collective bargaining power to reduce costs across the board. 6. Fee-for-service model. The fee-for-service model prevalent in the U.S. healthcare system incentivizes quantity over quality. Providers are paid based on the number of procedures, tests, and visits rather than outcomes, leading to unnecessary or redundant services. This approach inflates costs without necessarily improving patient health. In contrast, many countries prioritize value-based care, focusing on outcomes and efficiency, which helps control spending. The fee-for-service model perpetuates a cycle of rising costs in the U.S. by prioritizing volume over value. 7. Defensive medicine. Fear of malpractice lawsuits drives many U.S. physicians to practice defensive medicine, ordering excessive tests and procedures to protect themselves legally. While this approach may provide some reassurance, it significantly increases healthcare costs. Malpractice insurance premiums, which are higher in the US than in most other nations, further add to the financial burden. Defensive medicine reflects the broader litigious environment in the country, where legal risks influence medical decision-making and drive unnecessary expenses. 8. Lack of price transparency. Healthcare pricing in the US is notoriously opaque, making it difficult for patients to compare costs or make informed decisions. Prices for the same procedure can vary widely between providers, even within the same city. This lack of transparency limits competition and enables providers to charge higher rates. Patients often face surprise medical bills due to unclear pricing structures, adding to their financial strain. In contrast, many other countries have standardized pricing, ensuring transparency and fairness in healthcare costs. 9. Chronic disease prevalence. The U.S. has a high prevalence of chronic diseases such as diabetes, heart disease, and obesity, which require ongoing management and treatment. Lifestyle factors, including poor diet, lack of exercise, and high stress levels, contribute to these conditions. Managing chronic illnesses is costly, involving frequent doctor visits, medications, and sometimes hospitalizations. Preventative care measures are often underutilized, further escalating costs. In comparison, countries with robust public health initiatives experience lower rates of chronic diseases and associated expenses. 10. High malpractice insurance costs. U.S. physicians face some of the highest malpractice insurance premiums in the world. These costs are passed on to patients through higher fees for services. The fear of lawsuits also contributes to the practice of defensive medicine, further driving up expenses. While legal protections for patients are important, the current system's focus on litigation rather than prevention inflates healthcare costs. Reforming malpractice laws could help reduce these expenses without compromising patient safety. 11. Hospital operating costs. Hospitals in the U.S. face higher operating costs compared to their counterparts abroad. Factors such as advanced equipment, large administrative teams, and compliance with complex regulations contribute to these expenses. Additionally, hospitals often provide uncompensated care to uninsured patients, driving up costs for other patients to offset the losses. The fee-for-service model also incentivizes hospitals to perform more procedures, further increasing expenses. Streamlining operations and adopting value-based care models could help mitigate these high costs. 12. Limited negotiation power. In the U.S., insurance companies and employers often lack the bargaining power to negotiate lower prices with providers. Unlike countries with single-payer systems that set standardized rates, the U.S. system allows for wide variability in pricing. This fragmented approach limits the ability to achieve cost savings through economies of scale. Patients, particularly those without insurance, bear the brunt of these high costs. Strengthening negotiation power through collective approaches could help lower healthcare expenses and improve affordability. Thanks for watching the video. Please subscribe.